conversation with all of you about what we got right. And truthfully, these are most helpful with what we can do better. The last couple have been really informative, and the size of the audience really varies. We've had transportation, affordable housing, public safety. This is our health policy conversation around what the future on that front looks like, followed by education, the end of this month, early next month, followed by government reform. And some of that will be around the line and government structure in New Jersey overall. The reason we do this, just as a starting point, is really, like that introduction video said, it's really important to me to run a different type of campaign, a campaign that is really substantive on policy, that we're not running for a title, we're running really to change and transform New Jersey for the better. Having the privilege of being the mayor of single most diverse city in the state and country for the last 10 years, you get a different perspective on what works and what doesn't work in government. And I think experience matters in this job. It matters with who runs for governor, and it speaks to what somebody has done in the past and more than likely what they're going to do in the future. Each of our policy plans are very, very robust and comprehensive because I do have opinions, but they're not absolute. And the important part of these conversations over the last couple of months have been that there's been a lot of really terrific insight from all of you on what I may be missing. And then we go back and rework it. And I do believe that we're going to re-release most of these papers again closer to the campaign and closer to the 2025 start of the campaign with more details and more feedback from all of you. Again, the purpose is to run a campaign on changing New Jersey for the better. Final point on that is that most campaigns run platforms that are broad and sweeping and not detail focused. And the reason for that is clearly that there's political risk whenever you say you're going to do something that might upset somebody. And I understand that. But again, with what I started with, we're running to really change New Jersey for the better. And that means being transparent with what I intend to do if get elected. Some of the ideas that we've started, I'll also point at, have been taken by Trenton and the governor and moved forward. I mean, there's a conversation today about the CBT, corporate business tax, on the transportation front, funding New Jersey Transit. I mean, the first place that was proposed as a direct revenue source for New Jersey Transit was in our transportation plan launched last year in a conversation much like this. And at the time, got some pushback from others, but we knew it was the right thing to do. New Jersey policy perspective helped us with advocating. And then after that, you saw the Senate president and you saw the speaker get on board. And now you see a place where the governor is on board. It's similar to the conversation on COA and affordable housing and our affordable housing plan. We outlined in detail what we were going to do to transform COA. Not saying we had all the answers, but really leaning into the issue. The legislature hadn't touched it in 20 years. We engaged, we outlined in detail what we were going to do, and then lo and behold, last month you see a bill move forward. So I want to say thank you for being part of this conversation from the entire state of New Jersey, and look forward to your feedback. The way the conversation usually goes, I assume that if you're here, you've had access to the white paper and the policy paper that we released around the health policy. And basically, they're outlined all the same. The first half of it is what we've done in Jersey City. I'll go through some of that broadly. I think it's important because the best indicator of how somebody will act in the future is really what they've done in the past and what are the accomplishments that they've done and what have they learned from that. And then based on what I've learned, the second part of the conversation is really what I think are the priorities for the next governor around health policy. And then when we're done with that, which I would assume will take about 20, 25 minutes, the rest of the hour is just really going to be a conversation where questions and comments, and none of it's moderated. So we're not going to censor anybody for saying anything. We really want to hear your feedback and have an honest conversation about, where we are and what you think I'm missing and what we can do better. So does that work for everybody? All right. Can nod her head if it does. I see a couple people. All good. All right. Anyway, the first part structure is really around healthy food access. One of the reasons that I started with that is because I do believe that it is a pillar of longevity. I think that's clearly outlined. And in certain areas in New Jersey and certainly urban areas, there are food deserts. So we've really taken a comprehensive approach on how do we improve food access to our seniors, our low-income communities, and how do we do that with a clear policy agenda. And we've done everything on this front, from giving vouchers out for seniors that go on supermarket tours and educating them on healthy eating and healthy buying and how to better read a label to stretch their dollars further, to grants to a healthy corner store so you can educate store owners on how to better market healthier food as opposed to Twinkies and soda and potato chips at the cashier. And little things like that have had a huge change. We've incentivized new supermarkets here, used tools to do that. We've also expanded our Meals on Wheels by 20%. That's been a concerted effort. So food access has been an important part of what we do, and that's why we've led with this. Next page, we talk a little bit about the homeless front and what we've done in Jersey City. We've done a lot there too, and I really pride myself on being a state leader with regards to what types of services we're delivering, whether it's building relationships by providing better access to mobile showers and then bridging the gap using the showers towards social services, or building the first new homeless shelter in Jersey City in decades, which we opened at the end of last year, or building, housing for homeless veterans and putting that into our affordable housing plan on how we're going to expand housing and services for the homeless. Jersey City has really been a leader on that. And so we have familiarity. We talk later about dealing with the homeless population and what types of things we're going to be able to do statewide on that front. I want to highlight that, today we're in a place where cannabis is legal in New Jersey. Jersey City has been probably the municipality that has been the biggest advocate for that. We were the first with our municipal prosecutor to decriminalize cannabis in how we deal with it from a municipal standpoint prior to it being legalized here. And we've taken the stance that we weren't going to take artificial or set artificial boundaries to the cannabis industry here in Jersey City. We're letting the free market decide as opposed to a mayor or council setting an artificial number. We're letting the free market and the best operators decide ultimately who succeeds and fails here. So opportunity to create a whole new industry here. And we've worked with our employment and training and our Office of Diversity and Inclusion in order to facilitate more introductions for the workforce from Jersey City into that industry. So I think we've been at the forefront of that, a lot of things that we can replicate. Prisoner reentry, how we deal with second chances. Governor McGreevy's program started out of the Jersey City Employment Training. That is the largest program in New Jersey right now. It originally started in JSEP when we hired him because we had him as part of our policy agenda. He helped us formulate it in 2012, 2013, when I ran for mayor. I'm not by any stretch taking credit here because he's really kind of driven that. But I think that the fact is that it started really here in 2013 with our administration and our council willing to fund and support that as a priority within our city. Veteran services. I'm a veteran, as you can see from the introduction. It's something very close to my heart, whether it's housing, whether it's how we've dealt with things as little as parking permits, whether it's bridging the gap on social services. Jersey City has really focused on veteran issues. Women's health, it's more than just access to birth control and abortions. It is more than that as it relates to what we've done in Jersey City. In Jersey City, you talk about partnerships with Planned Parenthood that are comprehensive in how we provide services to low-income and immigrant communities. And we've done the first in the state pilot programs with our WIC, which is Women, Infant, and Children, along with Planned Parenthood, to make sure that everybody has options here in Jersey City and access to those options. So again, a lot of people talk about it. I'm really proud that we've had tangible steps here in Jersey City that really set a high standard and is indicative of how I would react and act as a governor. Domestic violence prevention. We've had a tremendous success rate here. Again, it has been a priority for administration. whether it's a diversion program from the courts, which has been very successful, and then it leads to classes that are mandated. We've done hundreds of them, and it's been a success story here. So highlighted because I'm really proud of what our health department has done on that front. So getting to the next part of this, and we talk a little bit about at the beginning part about priorities for the next governor. And I really do believe that thinking comprehensively about that first year of life and how you help parents and how you help that child is at the forefront and should be at the forefront of any priority for the next governor. And we've outlined here a bunch of steps. We've worked closely with New Jersey Policy Perspective in order to kind of better understand their objectives, some of the different advocate objectives, to kind of find out where we are and what we think we could actually meaningfully accomplish. Paid leave is the best place to start expanding it. It's something that we have a track record of expanding in Jersey City. So what the state hasn't covered, we bridge the gap on that in Jersey City already on parental leave. But we think there's an opportunity to expand that statewide. I outline it here. From 12 to 24 months. That bonding time is important. It reduces the need for childcare costs because you have parents that are involved and at home. And it is something that we would prioritize. The legislature is considering something now. We would put that and move that forward. How subsidies work in New Jersey. The priority here also is how do you get dollars into parents' hands at the day that the child is born? Today, there is a labyrinth of qualifications that only happen after the child is born, and that gap in time is very problematic from a lot of the parents that we speak to, and we think that there's an opportunity to reform that and really move that forward in an easy way that costs very little, but that will change lives for new parents. Moving on to the next page, childcare reform. This is the first place in the last 3 policy papers. So affordable housing, transportation, healthcare, and public safety. And I pride myself really on everything that we propose. We outline how we're going to pay for it with diverting an existing revenue, restructuring an existing program. This is the one place where we say that it will just be dedicating new funds from the general funds, and it will be a priority for us regardless of how we get there. There is no clear dedicated route to this today, because today it is a lot of different revenue sources that come together from federal and state. But childcare reform and giving parents an opportunity to have a childcare center operational at a low cost in their vicinity is a priority for us. You can also improve how EDA structures incentives to build more child cares, because part of the problems today are around how they reimburse from the state to those child care facilities, number one. And number two is how they incentivize new child care facilities. All right, I want to talk a little bit about hospital consolidation, because it's something that, when we first spoke about our healthcare policy, it was something that I highlighted, and I think it is a problem that needs to be addressed. Some of the issues around how these things happen in New Jersey, how Horizon integrates with the legislature, and how the hospital system integrate with the legislature are a byproduct, I would believe, of the political system that we have here. There's a lot of conversation around the political lines. The political lines lead to what I would deem in many ways is a corruption tax, that you don't have scrutiny over legislation that is in the best interest or detrimental to the public, because people are more beholden to the political structure than they are to the voters. But at the heart of some of these things on the healthcare front is a fundamental question around the massive amount of consolidation that you've had in the hospital space over the last couple of years here in New Jersey, creating these mega systems that squeeze out the smaller systems, that create less competition, and at the same time, how they acquire the private practices. So the private practices then are beholden to the hospital system, and they're controlled for leakage on how you refer, and what you refer out of them. We hear time and time again from doctors that is the biggest issue and the biggest challenge that they have. And it is something that the governor should confront directly, and we will. With regards to Horizon, Well, I'm sure we'll talk a little bit about rate increase on public employees and municipalities, a tax increase that you all see, how Horizon facilitates their third-party administration of the New Jersey program, why I think that is a problem, that there's a lack of competition. And if you don't believe what I'm saying to be true, you just need to look about how they've operated within Trenton with a sense of entitlement, whether it's fast tracking their move away from a nonprofit, or it's their board today is essential dumping ground of former politicians that are compensated without an expertise on healthcare. Again, something that we put spotlight on because we do think ultimately that that's important to change for a better New Jersey. I talked a little bit about reproductive health care and abortion access earlier. I think we have a track record on that, and it's something that Governor Murphy has actually leaned into and the legislature, and they deserve credit on that, and we've touched on that. Moving on to page 13, because I do want to get to the comments and the questions. We talk a little bit about changing Medicaid. The Medicaid structure on how counties deal with it and putting it more into the state. So there's a more unified approach throughout the state of New Jersey on how reimbursements happen. Again, time and time again, we're talking to experts. This was something that we've heard repeatedly. And then going towards the end, we talked a little bit about drug and substance abuse treatment, how we would change housing policy in order to deal with this, how the EDA today focuses on that, and the HMFA, it's outlined in that we would deal more with leaning into this as an issue to incentivize people to build housing and provide access for people in this situation. So that's broad speaking, and I'm sure we're going to dig into things with a little bit more detail, and I'm going to take notes. And if you have questions or comments or things that you think that I've missed, please let me know, and we will come back to you on it. So I'll turn it over to Lisa, who's with me here, and she will mention or select whoever the first person is.
It's gonna be Janie.
Oh, Janie, I apologize. Not Lisa. Janie's doing it. Okay.
Yeah, hi. Okay, so our first question is coming from Jordan Weisinger. Jordan, if you're out there.
Hi, my question was, have you and the campaign started to look at the possibility that private employers eliminate their benefits, their employers' sponsored benefits? We know that the business groups have started to lobby now, and it's usually 5 to 10 years until they actually act on it. But employers have agency; they can modify the benefits any way they see fit. So, has New Jersey considered that even a remote possibility? And are we ready to accommodate that? And like, what policies and how would we respond?
About eliminating or limiting on what employers can restrict or can't restrict was the question?
No. Employers have agency. They can
Sure.
choose not to provide benefits. So the question is, how would New Jersey respond to that outcome? And would there be consequences for profits for the 20% of gains they'd see from dumping the policies? And then how would New Jersey cover subsidies on the overflow?
It's actually the first time that somebody's asked on that. Do you have any references of states that you think do it well, Jordan? Or
no. This is cutting edge. Maybe a month ago, the business lobby groups, commerce, and on the national level were discussing how the cost drivers were outpacing their ability to maintain the benefits. So they were considering long-term solutions to drop the benefits. So we know that's a pipeline for 4, 8 years, 10 years.
Okay, it's perfect. I made a note, and we'll circle back. I mean, it's the first time. Well, the way we do these things generally are, obviously we have some experience as 10 years being the mayor, but we spend a lot of time with hospital leadership, with Horizon leadership, with other insurance leadership, with private doctors, practitioners. And it's the first time that somebody's brought that up, Jordan. And like I said earlier, healthcare is complicated and a labyrinth of rules and needs and touches all of us. So I would expect on this is going to be more feedback on things that we need to dig in more than me having absolute answers on everything.
Sure. Yeah.
I made a note, Jordan, and we have your contact info, so we will circle back on that. Okay?
Good enough. Thank you.
Thanks.
Okay, our next question is coming from Lloyd Alterman. Okay, Lloyd.
Thank you. Mayor, thank you for your comprehensive plan and your position paper. I think it's wonderful. I know you're a candidate for state office and not federal office, but I just wanted to get your thoughts about, first of all, you're probably aware that Jersey City passed a resolution in their council on Medicare for All in support of it.
Yeah.
I am a staunch advocate for that. I'm a member of an organization called New Jersey Universal Healthcare Coalition, and I wanted to make you aware that there are two bills in the state legislature, both in the Senate and the Assembly, which are designed to make New Jersey a demonstration project to provide Medicare benefits for all New Jersey residents. And I wondered if you had any thoughts about that and thoughts about how private equity and Wall Street are kind of taking their sinews into the healthcare system and what we could do about that.
Yeah, so two things on that. Yes, I am familiar with the bill. Yes, I am a supporter of Medicare for All. We have been following closely what California has been doing and the study and the process and the pushback, trying to learn a little bit through it. I don't know all the details of the New Jersey bill, but there hasn't been a state that has done it yet on the state side and done it well yet. I think you would agree with that, right? It's still
I agree that no state has gotten it done.
Yeah,
What we're doing is something unique. We're proposing that we use the existing Medicare infrastructure to provide for the third-party administrator for New Jersey. We don't believe that a state bill itself or a state plan would make economic sense. Why not use what's already existing and try to work through that?
The state plan, Lloyd, do you have the bill number or no? You don't know?
Yeah, it's S304.
Okay.
Senate 304, and the Assembly bill is A4538. That's being revised, and it will probably be renumbered in the current session. But I'd love to have you look at it and give your thoughts.
Yeah, we will. I made a note here. And the California program, if I'm right, is creating a California plan, correct?
Correct.
Yeah, that's right. And it's got a lot of pushback for obvious reasons, right? So I'll take a look at that. We have been following that because it's obviously been front and center to conversations and understanding the affordable access component to it. And like I said earlier, everything that we're putting out here, we try to make sure that it's funded and there is a route to pay for it, right? Because we don't want it to just be pie in the sky saying we're here, the things are really going to change. A lot of the things in the paper is stuff that beyond the child care and the first year, a lot of that is structural changes from a management standpoint that we can do and get done. So I will review this and we will circle back on that, Lloyd. I wrote it down over here. And as you know, we do follow these sort of things nationally as part of this, like I did mention.
Thank you so much.
Is that the bill that Raj Mukherjee, is he the sponsor on one of them?
That is correct, yes.
Yeah.
Raj
Okay.
and Assemblyman Allen and Senator Stack.
I'm familiar. Yep. Okay.
Okay. Our next question is from Latrenda Ross. Latrenda, I've asked you to unmute, so if you can just unmute.
Hi,
There you go.
Hey, Latrenda, how are you?
I'm doing well, and yourself?
Good.
Good. I have about 1,000 stuff to say, but I'll just concentrate on one. I've been working in social services field for 3 decades, 30 years. All right, this is my passion. I love it. I love to help people. But I'm finding a lot of times, especially one issue is with the Medicaid of our elderly people applying for Medicaid under MLTSS, right? Which stands for Managed Long-Term Supportive Services. This is the Medicaid piece where people need home care services. In order to get that, you have to apply for Medicaid under that program. And what I've been finding out a lot is that a lot of elderly people, not only elderly, but all those that may be eligible, have to submit 5 years of bank statements, okay? It needs to be changed. Why does it need to be changed? Because first of all, we have a lot of elderly disabled people that really don't have access to technology. That's number one. So they can't download bank statements, whatever the case may be. Then you have a lot of elderly people, disabled people that their memory is short at this particular time. So they don't remember if they had a bank statement, say 10 years ago or 15 years ago or 8 years ago. However, when the system says that you had a bank statement with Bank America 10 years ago, they're requesting those documents. They're requesting a letter from the bank to say that we no longer have that account. It is frustrating because what happens, it delays the application process. And what happens is that now you have these people who cannot or they're not eligible for Medicaid until they get these documents. It's very frustrating. It happens on more occasions than you can ever imagine.
But Trina, is that federal rules? It sounds like it would be, correct? It's not like,
Yes.
like, yeah, so we're gonna have limited control over that. Have you ever spoken to their Congress delegation or federal delegation, both Senate? I mean, it seems like a reasonable thing for them to push to change.
I have not, but that will be my next stop too.
Latrina, we have your email. We will connect you to our congressman here, okay?
Okay, thank you.
Problem.
Okay, our next question is coming from Anthony Brusca.
Hi. So my question's generally surrounding funding mechanisms for healthcare. I know we touched on single payer versus multi-payer before, but what are your thoughts more generally on how to pay for healthcare, its ties to employment, whether it's single payer, multi-payer, and what would you advocate for as governor for either a state or federal level?
Single payer, multi-payer, what would we advocate to change on the federal level front? I can't hear him.
Anthony, you can unmute yourself.
Yeah, Anthony, could you?
There we go.
repeat the question?
At the state or federal level.
Yeah, I don't
So
know. I don't know what flexibility we have, obviously, on the federal level. I mean, to make change on that front. And from the state standpoint, you know, more competition within the state programs, I think I've been pretty out there on, I think are a good thing. I don't know with regards to overall beyond that, what we have access to. I'm going to read what Lloyd is mentioning here as far as what New Jersey has an option on the single payer front. The first time that I've heard of any state or governor having flexibility around that. So I'm interested in it, but I don't know enough about it.
And what would you more advocate for as governor as well, not just policy within the state?
As regards to Medicare for all or no Medicare for all, or yeah,
Or
I mean, I'm
other systems.
I'm a supporter for more access in Medicare for all, as I said earlier. I mean, whenever asked, I answer that clearly. Obviously, I think that the healthcare system is broken today on the costs. I see it also from how we deal with it in Jersey City. We're self-insured, and I think where you could get reform and more coverage is a good thing generally, and we're the only country that does it this way.
Thank you.
Can't really go ahead.
Okay, our next question is from Deborah McWilliams.
Yeah, hi.
Hi, Deborah.
Hi. This question I have, this has stuck in my craw for the last 20 years. I had a family member who was elderly and she was on Medicaid as well as Medicare. When she died, I got a letter from Medicaid. They wanted to know if there was any money left because they wanted it. She basically had no income. She was on SSI. I was the one taking care of her, you know, all the bills and stuff. This has stuck in my craw because they only go after people, single men and women who are 55 or over. And this is just, you know, so I did some more research on it. And this is just has stuck in my craw because you have a lot of elderly people that might be on Medicaid. Why is this the only group that's singled out? She was almost disabled. She was in a wheelchair. She died in her, you know, late 80s, but she was on both Medicare and Medicaid. And this, when I got the letter, I was shocked because it was like less than a month after she had passed. And this has just stuck in my craw because sometimes people end up on Medicaid maybe when they're older because for different circumstances. Why should this group be gone after and nobody else is? Because it seems like they're treating all these are 55 and over. This is senior citizens, and you're treating them like less than nothing. But somebody could be on Medicaid, have 20 kids. They won't go after them, but they're going after senior citizens. Why?
Yeah.
Can you?
Deborah, so Deborah, after 20 years, I wish I could give you an answer, but the challenge a lot is that a lot of this stuff on the Medicaid and Medicare front are federal issues. I need to connect you to our congressman here. I mean, you and I have known each other a while, so I could surely make that introduction. But I think, like, if you listen to a lot of the questions that speak to the larger problem and where there's the federal issues in access and Medicaid and Medicare and who has access and how, a lot of those issues or limited issues the state has control over. Some they do, but not broadly speaking on the policy front here. So when somebody asks that question, I will make a note, as we are doing here. We'll connect you over to the right people on the federal front to try and get it accomplished or addressed.
Okay, next up is Shane.
Hi, so just going back for a second to the nutrition and food security part from the beginning of the plan.
Yep.
I was wondering if you have any plans to support the development of regenerative agriculture, urban agriculture, as someone else earlier mentioned, vertical farming, like these more sustainable, localized forms of agriculture, especially with the consolidation we've been seeing on the national level with agribusiness and the agriculture industry, and the fact that like New Jersey used to and hopefully can be once again one of the major bread baskets of our country. Has there been any effort, and a lot of it's on the federal level, like with the 5-year farm bill, but has there been effort, or will there be effort on the state level to support sustainable agriculture, regenerative agriculture, urban agriculture?
Yeah, it's a good question, Shane. And what I said earlier is that I think that somebody's past is indicative of how they will act largely in the future. And, Jersey City runs one of the largest municipal urban farm programs. We have a partnership with Aero Farms in our Jersey City Housing Authority, where we have, we're in the process of building 10 farms. I think half of them roughly are completed at this point, growing leafy greens with the technology that allows you crop turnover much faster. It's within our housing sites. So what we do is that we couple that with education around healthy eating and classes, and of course free access to the food as part of that enrollment. And it's been a success. So it's obviously something that I'm proud of here. I probably should have touched on it a little earlier, and something we'd look to emulate and encourage statewide.
Okay, we have a question from Cynthia next.
More comments, Cynthia. How are you?
Hi, Mayor. How are you? Thank you for
Good, how are
taking my
you?
question. So as you know, I work for an urgent care organization, and many of our centers are located in what turned out to be the epicenter of the COVID-19 outbreak. And my question to you is, I don't know if you had a chance to look at the report that was recently released by the governor. I know it's 900 pages long, so I don't know if you had a chance to do a deep dive, but I was curious whether you had any thoughts on New Jersey's emergency preparedness and what we could do to enhance our public health infrastructure so we're better prepared in the future.
I haven't finished it, to be honest with you, Cynthia. So I wasn't expecting a comment. I probably should have been expecting a question on that. You and I met at a Bergen County meet and greet originally around the urgent care access in New Jersey. And then we followed up with the group because there was a lot of really good suggestions around, again, how Horizon and the insurance companies control how they open, when they open, who has access to open, who decides that there's too many providers or too little providers as opposed to you as a patient. all things that we touched on in this with regards to how Horizon is dictating healthcare ultimately, as opposed to what's not necessarily in the patient's best interest. So I don't know yet an answer around what we could do differently from what Governor Murphy did specifically around COVID and responsiveness around that. I obviously dealt with it from the Jersey City standpoint and a lot of overlap in partnerships, but I do think that a lot of the things we discussed at that meet and greet with regards to Horizon controlling access and who can and open and when they open is part of the fundamental problem there, and who's dictating healthcare.
Okay. Thanks, Cynthia. Our next question comes from Ryan Spain.
Hi, good evening, Mayor. So I have a question, but first, just a quick comment. I read a few hours ago that the campaign will be filing an amicus brief on some of the arguments that the Middlesex County Clerk is making regarding the line issue. So just want to say I'd love to see that.
But read it tomorrow, Ryan. I think our deadline is 5 p.m. as I was told.
Amen. Amen. So the question has to do with the hospital consolidation.
Yeah.
So within that part of the policy paper, you talk about how the consolidation of the healthcare market, specifically the consolidation of hospitals, has led to higher costs, higher premiums. And that's an area of policy that I'm really unfamiliar with. So I would just, I guess, love to hear your thoughts, your ideas, like if you can just elaborate on that a little bit more.
Yeah, I think what you've seen is, first of all, there is clear overlap on business interests, and oftentimes there's good examples where they're in business together between Horizon, the largest health insurance provider in New Jersey, and the hospital systems. There's overlapping there. And then as the systems have gotten larger and more influential, you've seen them obviously having advantageous reimbursement rates at the expense of some of the smaller providers as well, where it's impossible for smaller hospitals to compete, is essentially, so they get squeezed out. At the same time, when you have consolidation of the hospitals, you also have consolidation of those hospitals acquiring private practices as well. And it becomes impossible, because of the way the referrals work between the private practices and the hospitals, impossible for independent providers to compete in New Jersey anymore. And all of those separations, which ultimately act as checks and balances for good outcomes for patient care, are what's compromised when you have lack of competition and people dictating how that monopoly looks. And so I just think that what you've seen is less and less hospital systems here, and it comes at the expense of good patient care. And, you know, as we've spoken, when I was doing a lot of the research for this, we spoke to a lot of the leadership in the different hospitals. I spoke to one of the major hospital systems, the CEOs of one of the major hospital systems that has consolidated a significant amount. There's 3 or 4 of them. I spoke to one of them, speaking to him about the fact that generally speaking, monopolies are not good in any industry, right? So I have a hard time accepting that this is a good thing. And his response was that he acknowledged the fact that it isn't good in most instances, right? And he would even say that some of the other ones in New Jersey that have consolidated don't do it well, but he said that they do it well. They're different, right? And it was the best example that that's probably not happening anywhere, right? That I'm probably on the right path there, that the lack of options and dictating where you can go and how you can go without you even knowing it, by reimbursement rates and the consolidation of the healthcare providers in the hospitals, ultimately is not to your best interest and to nobody in New Jersey. And nobody's calling foul on it because of the massive lobbying arm that happens with the hospital system and Horizon, as I touched on earlier. So I think that ultimately comes to detriment to all of us.
Okay. Our next question is coming from Cesarina Santos. Hi, Cesarina, are you out there? I don't see her.
Okay, we have lost her.
Yeah, I don't see her. So Mayor, if you don't mind, I'm going to ask you a question that we received by email.
Sure.
In many other states, community hospitals have been struggling to stay open. How will your administration protect New Jersey's community hospitals?
Yeah, I think I go back to Ryan's question. I think the consolidation has really been harmful for those community hospitals. It is impossible for them to compete in the landscape today. The reimbursement rates at those large hospitals are just so much better economically, and those small ones are at a disadvantage. And I think oversight and scrutiny will correct a lot of that. One more, Janie?
Yeah, I think we've gone through all the questions. However, there is one that I wanted to close with from Matt. Just grab him. It's a little bit off topic here, but I wanted to give Matt an opportunity to ask his question. Okay, Matt, can you unmute?
Are you gonna give Danny Hurley another key to the city?
I guess we'll see in a couple hours, but I spoke to him before the tournament started, just wishing him luck. You know, the fact that last year he went through the run and highlighted his Jersey City roots and how proud he is of being from Jersey City really hit a special chord with everybody here. Because are you from Jersey City originally, Matt?
35 years in Jersey City, and now I live up in Sussex County.
You know, I'm going to just close on one thing that I think that one thing that works in my favor towards this, and maybe you can attest to this, Matt, that works in my favor that you can't poll and you can't really gauge what it is in this governor's race, is the fact that Jersey City has this special thing with people that are from Jersey City, right? Or that have ties to the city, that even when they leave, they still identify as Jersey City people, and they're always cheerleading for the city. And
Oh,
Jersey,
yeah, exactly, like St. Peter's College and everybody else.
and we've been a net exporter of people to Monmouth and Ocean and Sussex and Bergen. Recently, we've been an importer of people back in, but it is a good thing because we're all over the place, us Jersey City people, and that's a good thing, I think, for me. So, thank you.
No problem.
All right, with that, I just want to say thank you. If you asked a question and we said we'll connect you to your federal representative, we will do that in the next couple of days. If you have another question or comment on something that I missed, please let me know, and you can just send me a note on that. And you know, we look forward to doing more of these, and each time different level of turnout based on who cares about a specific issue. This one is obviously a little more complicated and a lot of overlapping interest, but we appreciate you taking time on a Monday night to join us. So thank you all, and we'll see you soon.